So the big news came down, and it came down from a judge. I think the judge was out of Florida, a federal judge that said, look, they don't have authority anymore. They can't do this. They can't force you to wear a mask in an airport and on an airplane. Obviously that was greeted by many of us who travel, and I've been in airplane a lot lately, with a high five, right? Certainly with that flight attendants and with that pilot and that, person at the gate that has had to be the policeman of all of this, that had to be a big relief. Is it the right thing to do scientifically? Are we sitting there looking at situations where, we basically have left the science behind because we're just sick of it? I don't know. I don't know, but that's one of the reasons that we asked Dr. Avish Nagpal to come on. He's been one of the individuals that we've been able to count on. He's an infectious disease specialist with Sanford Health. Dr. Nagpal, good to have you back coming down the road with us.
Hi, Joel. How are you?
Doing well. So, the screams, the shouts, the hollers, the people that are happy that are on the airplanes and in the airport that they don't have to wear masks anymore. Was that, I was going to ask it to you this way, was that a good ruling?
I don't know. I'm nobody to judge good or bad, but I think I understand where people are coming from. We have lost the public support and investment in masking. So I think the public opinion has turned against it, and I do understand it. That's normal human behavior. I could see this coming. I think with the cases being low, treatments being available, the people's opinion has turned that if not now, when are the masks going to go away? And I think that's a valid question. So I'm not surprised by the ruling. I think we could see this coming.
So is there ever going to be a study, something, and this is obviously, a guess on all of our parts, but is there ever going to be some scientific data that shows that masks worked?
Yeah, so I think we have enough data now. If you look at all the studies that CDC has published, especially based on the school mask mandates, it does show that they are moderately efficient in controlling the disease, spread of the disease. So I think they remain a significant tool during the future pandemics. And I think part of me is actually okay with mask mandate going away right now because they are inconvenient, and we were at a point where if we pushed it anymore, then we probably will end up losing more good.
Dr. Nagpal obviously having a little technical difficulty, and he'll be joining us back here in just a second. But, he's talking common sense, ladies and gentlemen. Okay, Dr. Nagpal, you're back. I'm sorry. We missed a little bit of that.
Sorry if my internet connection is unstable. I was saying that, there have been enough studies by CDC on school mask mandates that show a moderate efficacy of the mask, and they remain a very good, important public health tool because to manage the future pandemics and to manage patients who have TB or, chicken pox and things like that, we will continue to use the mask. But we are at a point where public is getting tired of that. So in order to, save this public health tool for future pandemics when actually needed, I think it's okay if we are not using them now, given that the case count is fairly low at this point in time.
What about the variants? Is there anything out there that would cause you to change your opinion? That would cause all of us to say, now, wait a second here. Maybe it's time to put them back on.
Yeah, so that's what I meant by future. You'll say we have a variant that breaks through that is not protected by the vaccine, or the one that against which the current treatments don't work. If that comes around, I think we will need to go back to masking. And in order to do that, to have the flexibility to do that, we need goodwill and public support. So I think my fear was that we were losing public support on masking because they are inconvenient, and we have been using it for the last 2 years. So they work. They are inconvenient, though.
Well, I was talking to someone on my radio show today, and I said, for myself, who has been vaccinated and boosted, and I haven't been back for my second booster, so I'm not trying to misrepresent myself. I will. I haven't taken it as seriously as I probably should. I need to prioritize it rather than say I should. But for me, in the workplace and in that airport, I'm like, what's my reward for having the common sense to be vaccinated? What's my reward for doing what I know was the right thing to do? Why do I still sit here and have to pay a price for what other people haven't done? And why should I care if they chose to get sick? And I know that's out there, Dr. Nagpal.
Yeah. Yeah, that's a hard question to answer, Joel. We do what is right. We don't worry about the rewards. We know that this is something that we had to do, so we did that. We do what we are supposed to. We don't do it for any rewards. Thank you for being a good citizen and for understanding why it's needed. And thank you for promoting it when we actually needed it. I think we just need to live with the fact that it is what it is right now.
See, the difference between you and me and what we just discussed, that I was selfish and you weren't. You based what you did on science and being a decent guy, and I was like completely selfish in what I said, which is, I just want my life back, and to be normal, I'm vaccinated. And so I know that that's the sentiment of a lot of people out there. Just a quick update in regards to what you're seeing at Sanford in regards to your emergency room and the people that need you. What are you seeing?
Yeah, I think we are okay for now, Joel. I say that for a number of reasons. We haven't seen a lot of hospitalizations. Our hospitalization rate for COVID is like down to minimum right now, the minimum that we have seen throughout the last couple years that we have been dealing with COVID. We have outpatient treatment options. We have the ability to flex and do more infusions if need be. We have an oral antiviral. We have 3 treatments in the outpatient world that work. So I think our goal was always to make sure that nobody dies because they didn't get a hospital bed or a ventilator. And if there is a breakthrough infection despite vaccination, we still have treatment options. I think we are checking all those boxes right now, so we are in a good place. If you look at European trends, the BA2 wave is subsiding. In some countries, it's completely subsided. And we have been waiting for that wave to pick up, and our case numbers have picked up, but they are not picking up as exponentially as feared. So I think I feel comfortable.
Dr. Nagpal, you've always been generous with your time. I thank you, sir. Keep fighting the good fight.